Hi there, my name is Nysia-haillie, and I'm going to be going over my Rule 340B Pulse chatbot for HSCI 478. This chatbot was created to help address this problem that a lot of rural hospitals have when it comes to proving 340B savings to actually accept funds from the government to support patient care and access. Target users can be your primary users like the 340B coordinator, pharmacy leadership, finance team, revenue cycle, management, accounting, operations, CEO, CFO, COO. This is a massive problem because a lot of rural hospitals tend to close down due to lack of funding for this support. A lot of larger health systems have been actually taking advantage of this government fund. So a lot of these rural hospitals don't receive the proper funding that they're allowed to have and actually close down. The chatbot functions and purpose of this is to help these rural health systems log content easier. It's basically to have a consistent dashboard where graphs are legible and actually tells you your approval odds based off the documentation that is provided when logging in the information. So I used ChatGPT to help develop the prompt. Basically, it was designed for the assistant role for my Rule 340B tracker. It's basically to help create the prompt that I used for Base 44 that actually built the app. I asked for approval odds, and basically it was a copy and paste system for Base 44, basically designed to add in a field structure that supports the graphs, categories, role impact, and document status. When using Base 44, I used it to create the app, transaction list, the details, site, and the assistant for this assistant that basically is the chatbot that's going to be used when adding in each transaction. It's a build form that matches data models with site, date, amount of money, and also the description category, the role impact, and document status if it's missing anything. And then let's see here. I'll click this in a moment. This is the actual Base 44 app that I created. When it comes to ethical operational and implementation considerations, I made sure that this chatbot does not ask for PHIs. It has a neutral tone. It avoids accusations. It focuses on document gaps. There's a lot of transparency. And then this can actually also be implemented within like a 10-minute training guide, basically, so that the workflow of a stakeholder when actually implementing this information, it doesn't ruin their workflow and it doesn't add increased stress. So when it comes to how this chatbot can improve healthcare delivery, basically it'll be a stable support ground for rural funding. It helps keeps hours open, hospitals open. Basically, it'll help provide actual credible documentation for when applying for this government funding that they'll actually be able to have and also know their approval odds. So a little bit of limitations. It can't technically prove anything alone. It has to really depend on who is entering what data and what data is being collected. Bad data in, bad data out, good data in, good data in, good data out. You know, and so for the future, for instance, it could technically be auto-linked to finance systems that actually reduce manual entry. This will help with data errors, and then also add in an outcomes field to show impact, basically if it has a high or low impact on actual patient access and care. The references I use were this Cow Matters article and also the 340B hospital markup program. I'm just going to click these both here really fast just to show you. So this talks about 340B medicine markups that are gold mine for big hospital systems. Like I said before, a lot of these big hospital systems use this government payout and it basically takes funding from rural hospitals. The reason why I was interested in this was because I actually read this article. California's crisis in rural healthcare is also a chance for transparency. They talk about Glenn Medical Center in Willows, which is located 75 miles north of Sacramento, and it basically closed down because of the lack of funding that it received. As I click my Base 44 app here, we're going to be taken in. Let me make this screen a little bit bigger so we can see it. So this is our funding dashboard. We can see our total savings, high approval odds, stock documentation, active sites. I've created 3 active sites as an independent contractor myself doing these audits for them, hypothetically. So we see patient care, medication staffing, infrastructure, IT, community, and admin savings by category. Our approval odds are based, we can actually change this within our log transaction. As a user, you can add in if it's high, medium, or low based off of the document quality. And we also have here strong, okay, weak, missing, and also our rule access impact. When logging in a transaction, we can pick Prairie Health Clinic. We can pick, let's do Mercer Valley. Let's select today's date. Let's do 10,000. Our vendor, Valley Med Health, just say some random vendor that we are getting medical supplies. Supplies from. The document type is going to be a purchase order. Category is going to be, let's say, staffing. Let's change this. Whatever you want to add in your description, you can do medication. I just wanted this to match with our category, medication access, role impact. This basically reduces patient cost. And say we have a few documents, more than 3, it's going to be strong to add into this. Our approval odds are going to be medium because it's medication access. We're going to have an audit through this. Missing documentation, let's put none. And notes, pharmacist. Pharmacist needs to add, for instance, just to keep things short and fast here. We'll see our transaction right here, medium and strong, medication access, and you can see it all here along on our dashboard. It changes. Perfect. All right. I don't want to go over my time limit, but thank you guys for coming along and going through my app with me. Thank you.